Hi guys, my name is Dinara Besimbekova. I'm a senior manager in health and safety department, and first of all, welcome on board and wish you good luck and hope you will enjoy time at Nazarbayev University. Let me share you the screen and I will show you what will be discussed today. Basically, this presentation is pretty short and sweet. We will discuss only two things. It's a health background form, how to fill it, and the health insurance form, basically. Well, let's go to the health background form first. Okay. So first of all, this form must be filled and signed by medical provider, and this is very important and essential that the provider will give us his or her contact in the end of the form, right over here and over here, okay? Basically, this form contains four big parts. Part one is required for all students, you see here. Part two is required for medical school, especially for those who will have a clerkship in a hospital with invasive procedures. And part three, it's additional immunization form, which is recommended but not mandatory. And part four is a health condition, actually, that shows, if you have any health issues, okay? And well, actually it's a part five, it's a kind of a passport part. Well, you need to identify the year of admission, school, program, your name, country, and so on and so on. But it's, you know, it's right over here. It's pretty straightforward and you don't need to be explained how to do that. It's pretty clear, I guess. Well, let's get started with the part one. Well, part one basically shows mandatory vaccinations against mumps, measles, rubella, tetanus, and diphtheria. Well, Tdap stands for tetanus, diphtheria, and pertussis. TD is for tetanus and diphtheria, actually. So MMR, it's a combined vaccination as well as a Tdap or TD with a lifelong effect. If you have been vaccinated with two doses with the period between dose 1 and dose 2 within 4 weeks, you consider to be immune against measles, mumps, and rubella. When it comes to the Tdap and TD, this vaccination is not lifelong and it must be effective within the last 10 years. If you know that this vaccination, the last one right over here, was done, let's say in 2010 and less, so it's not effective. You need to be revaccinated, okay? Let's go to the MMR vaccination. Again, it's a combined vaccination against measles, mumps, and rubella. Contains two doses, dose 1 and dose 2. You need to indicate date here and here, and the the period between them shouldn't be less than 4 weeks, okay? In some countries, or for some people who, let's say, was born in 80s or earlier, there were a separate vaccination against measles, against mumps, and against rubella right over here. That's why we indicated it separately. If you are not vaccinated with MMR, so you can indicate vaccination against measles. It's a 2-dose vaccine, actually. Against mumps and rubella, it's a 1-dose vaccine, and Tdap, TD is a 1-dose vaccine as well. However, with some infection, if you had this in your background, if you were sick actually, you need to prove that undergoing the serological tests. And here we need to date of the serological test and the results. Basically, it shows the titers of immunoglobulin G in your serum. So if you say that you were sick with mumps, let's say, it must be proven, okay? Let's go to the PPD test. What we have here, well, tuberculosis is a hot button issue in Kazakhstan, and we have one of the highest rate of tuberculosis in our country. So that's why we use preventive measures such as a chest X-ray and others. However, in some countries, PPD test might be applied. So that's why we need your health provider indicate the date of PPD test and the date when it was read, and the difference between place date and the read date shouldn't be less than 3 days. Here your provider needs to indicate the in duration in millimeters. So it shouldn't be more than 10 millimeters. If it's more than 10 millimeters, you should undergo quantiferon golden test or chest X-ray. And here, for quantiferon golden test, you need to indicate date. Here, results, whether it's positive, negative, or equivocal. If it's positive or equivocal, you need to undergo chest X-ray additionally. Okay. When it comes to the chest X-ray, you need to indicate date, results, and notes that was written by the doctor. Okay. Well, let's go to the part 2, requires for students. Students of medical school who will have a clerkship need to undergo the tests against HIV and hepatitis B in order to identify if they are free of these infections. And here you need to indicate the date and the results. For hepatitis B, the results shouldn't be less than 10 milliunits in 1 milliliter of the serum. If it's less, you need to be revaccinated. You also need to indicate the immunization data for against hepatitis B. It contains of 3 doses of vaccination, and the period between those 1 and those 2 is 1 month. Between those 2 and those 3, it's 6 months. So you need to be vaccinated ahead. Basically, most of you are vaccinated against hepatitis B. Just check out your form, okay? What about the additional immunization? In some countries, immunization against meningitis, HPV, and varicella are provided. So if so, you need to indicate it right over here. Basically, we need dates everywhere. If you saw the tables, you will need dates here. And when it's stated that we need to know your results, please, you need to indicate in the according column. Okay, part 4, it's a health condition. If you have a kind of special needs required for you, please indicate here. If yes, you need, the health provider need to explain what kind of health condition you have and what kind of needs you may need. And students with the chronic diseases also need to identify if they have chronic conditions and identify in this column what kind of chronic conditions the student has. So here the detail of the doctor, and this is pretty much it. And the form is not really difficult. If you show this form to your medical provider, he will understand what we're talking about. Okay, let's go to the health insurance coverage, okay? We developed pretty basic and plain health insurance coverage for our students. And it contains inpatient, outpatient treatment, dental care in case of acute toothache, medical evacuation, body repatriation, sorry to say that. And this is pretty much it, but remember that some conditions such as pregnancy and delivery is not covered, some chronic condition in remission stage is not covered, and I will explain you this later. And the full or total coverage is 15 million tenge here in Nazarbayev University. And one important note that international students will obtain this health insurance form upon arrival, because this form is actually this health insurance is developed in order to obtain medical services here in Kazakhstan, and it will not be effective in your country. Okay. Okay, what is acute illness? It's a condition under which immediate medical care should be provided in order to avoid some irreversible or severe negative outcomes. And there later I will show you the examples of that. Injury and, sorry to say, death. Well, what is acute illness? So it's acute pain, fever, unconsciousness, bleeding, surgical conditions, heart attack, etc. So basically, this is a condition in which health insurance will work. If you have, let's say, diabetes mellitus type 2, and you know it's in remission, so the health insurance will not work for you. And if you have any chronic condition, please bring your prescriptions and medical notes made in your country, so our doctors could assist you further if you have any issues with that. Here is our contact. So you can write directly to me if you have issues with health background form or health insurance, or there is a special designated email, SHIP. So if you have insurance query or any health related issue, please do not hesitate to contact us. And as I promised, it was short, and wish you to stay safe, and hope to see you all soon here at Nazarbayev University.